Okay, Dad, we're live.
Welcome. Happy New Year. Happy and healthy New Year to everybody listening. Today we're going to have a very interesting conversation with my son, Dr. Ross Kopelman, and he's going to ask me some very thought-provoking questions.
Okay, so Dad, I know that you started this channel about 18 months ago.
Yeah.
What has it been like to be on YouTube as a facial plastic surgeon?
Well, first of all, I had my doubts that this was even going to work. I thought that this was kind of, I don't know, a little silly in a sense. But what I've learned over the last 18 months is that I am helping people all over the world who ask me questions about either what kind of procedure they might want to have or about some kind of post-operative problem they're encountering, and they want to have guidance. And I think that the real utility of my channel is I have to be kind of a guardian and help people navigate through the process of choosing which procedure makes sense for them, and also maybe helping them choose the right doctors, and hopefully I'm helping them along the way to come out with the best results.
I want to highlight something to everyone. I grew up in a house where I would come home from school when I was younger, and you would come home from the office, and you would talk about patient care and how to take care of patients on a very high level. You talk about complicated cases, and so I grew up in a home where you kind of really were an educator from a very early stage. So it's interesting to see that leap that you've taken where you're now on YouTube and you're educating the general public. And I think that is, it's not a far reach because you are very much an educator in my eyes.
Well, that's in my DNA because my mother was a teacher and my father was a teacher also. So I guess teaching is in my blood, as you say. And so I take great pleasure in helping guide people through whatever process they're going through, and acting as a guardian to make sure that they're making the right choices. I can't say that I'm always right about everything I say.
He's not always right.
But I try to give them honest information so they can make informed decisions.
Okay, so you have very strong opinions about proper care of patients and doing the correct procedures. I know that over the past 18 months we've seen a lot of questions come in from all over the world of patients who are thinking about having different types of plastic surgeries or doing different cosmetic procedures. What do you think is kind of universal to all of these questions? What are some of the themes that you've seen kind of play over?
I think that people don't, just like if I was a patient and I was outside of my field, I wouldn't know where to go or to get the right information or to get well informed. If I'm going for any procedure outside of facial plastic surgery, or plastic surgery in general, I don't know where the right sources
Or
are.
who to trust.
Or who to trust. Yeah, where the right way, which way to go is the right way. And so I think people are always searching around, looking for the right answers, and they don't necessarily get those answers from the people they're talking to. In other words, one of the things that prompted me to go on and create YouTube channel content was I felt that people were getting misinformed, not only on YouTube itself, but also when they go for consultations, they also don't always get the right information. I try to give them my experience, which I've accumulated over the last close to 40 years experience in practice, and try to convey that information to them with no self-interest in mind. I want to try to make sure that they come out with the best possible results.
And one of the things that you always emphasize is about being conservative, like with the patients. When if you're someone looking for a plastic surgery procedure, to always like be conservative in terms of your approach.
Right. Don't try to do too much all at once. Try to think through what procedure should be done first, or second, or third, and don't jump and say, I want everything done all at once and end up with a big mess. I want people to have as few complications as possible. Now, every surgeon, anybody doing plastic surgery who does any volume of work will tell you that complications are unavoidable.
Everyone has a complication.
Everybody, most famous people to the least famous people, everybody will at some point in their career encounter complications. The question is then, how do those doctors or nurses, how do they manage those complications to mitigate the harm that could happen to any patient? So that's one of the key things that you have to think about. And in terms of who's sitting in front of you and talking to you, can they manage anything that is unexpected that could happen? So I think that,
and that's a theme I see running through a lot of your videos. You always emphasize, like,
good preparation, for instance, preparing prior to the surgery, make sure that things don't happen after the surgery. For instance, like taking no blood thinners, that can obviate a lot of problems following surgery, hematomas and swelling and this and that. All those things can be mitigated by taking the time to prepare appropriately for whatever procedure you're doing. And there may be something small or maybe something big, but it does require thought and go slow mentality in terms of thinking through all the steps that are necessary so that we don't end up with anything but a great result.
And you've covered a lot of topics on this channel. So you've talked about non-invasive procedures like fillers and injectables. You've talked about facelifting, brow lifting, eyelids.
Right.
You really covered a lot of topics.
Well, I try to cover as many of the common procedures that people are seeking, and I try to give my opinion about what's in my mind good and what's bad. I know there are some doctors who say, "Oh, this is absolutely no good," or "Absolutely no, this is good," or "This is bad." I believe there's always a middle ground. I believe that it's a little fuzzy in the in between, and there's truth to be found somewhere in between, not on the extremes. So I think that that's what I'm trying to convey. I'm trying to guide people through the process to make sure that they come out with great results.
And beyond your YouTube videos, you also have a podcast called The Beauty Doc.
Right.
What is kind of the driver behind that podcast?
So those podcasts are directed to other professionals.
So other plastic surgeons.
Other people doing cosmetic procedures, as well as the public who are deeply interested in a particular area. For instance, I recently did a podcast on new techniques in brow lifting with Dr. O'Daniel and other subjects on facelifting, and they're all very enlightening. So I like to learn myself from other doctors. I want to learn what they're doing, why they're doing it, what kind of problems they encounter along the way. So those podcasts can enlighten us all, enlighten me, enlighten the doctor I'm talking to, and enlighten the audience, whether the other professionals or other patients who are interested in those procedures.
I think one of the things that I want to emphasize is that I grew up in a house where I had an amazing mother and father. But what you both taught me is that you have to constantly be learning. And even as a doctor, you never stop pushing the boundaries of our knowledge. And so by doing those podcasts, the Beauty Doc, you yourself are becoming you're updating your knowledge constantly so that you can improve the results that you bring to your patients.
That's true. As Ross has stated, I believe that medicine is a ongoing educational process, journey, okay? It's a never-ending journey because the amount of information now that is emerging from all sources, from the internet, from other doctors, from lectures and books and so forth, it's constantly evolving and moving forward. And I think that the internet has allowed us to receive new information more quickly, and allows us to incorporate new techniques more quickly. It just doesn't just dribble down slowly. It comes at us very quickly, and I'm always trying to keep up with what's happening and what's new. And I don't always do what's new, by the way, Ross. I sometimes take a step back and say, maybe this procedure isn't such a great procedure. Maybe I'm going to wait to see how other people, fare in terms of their results that they receive from doing these procedures. And usually, my judgment is correct that after a year or two, some of these new procedures just fall by the wayside, and they're not anything that they're touted to be initially. And that comes with experience. I've seen the evolution of different procedures come and go, and I believe that.
And you talk a lot about that through a lot of your videos. You really try to educate the general public so that when they go for these procedures, they're very informed and very up to date, so that they can make the right decisions.
Yeah. That's always my motive and underlying motive. I want everybody to be well informed before they sign on to whatever their procedure they're considering doing.
Okay, so as we look into 2024, this bright new year, first and foremost, what are you excited about in terms of your channel? What do you want to do in terms of growing the community? We have about 8,000 followers that you have on your YouTube channel right now.
Yeah. So I think that first of all, the feedback has been very positive, almost universally positive to all the content that I'm putting out there. People seem to recognize my sincerity and and the kind of balanced view I project from my YouTube videos. I hope they're not too kind of lecture-like, and I guess that's my teacher mentality. But I want them to engage more with what I'm saying. I try to respond to their questions and give them, good answers to whatever questions that arise, so that they have an ongoing engagement with my channel and with my personality, I guess.
Okay, so any new additions for this upcoming year?
I think for me the most exciting, there's a couple new insights I think that I've extracted from my podcasts in particular. I think that the gliding brow lift podcast was very enlightening. I think it's a very exciting new procedure to do brow lifting, doing what's called gliding brow lifts, and it has I have particular interest in it because there are patients who have very high foreheads or their hairline is somewhat high, whether they're men or women, and you can make small incisions and raise their brow without making big incisions, and get excellent results from doing that procedure. The second thing is that there's been a big pendulum swing among some people. Some people were going towards deep plane facelifts. Now the pendulum is swinging back towards the middle, and some people are saying you don't have to be quite as aggressive in terms of doing what's called deep plane facelifts, and you can do more conservative facelifts and get good long-lasting results as well, which is basically where we started. So there's a big swing back and forth in terms of opinions amongst plastic surgeons, And I find that to be very interesting because there isn't only one way to skin a cat, as they say. There are multiple ways, and sometimes people end up with great results, and in different hands, different results, but maybe they're all great results no matter which way they do it. So that's kind of an enlightening thing to say that there's not one way to do something. There may be multiple ways to get a great result.
And what's amazing is this is even after 35 years of practicing, you're still having these new insights, and you're disseminating this information and sharing this and being very transparent by sharing this through YouTube.
Yes. Again, that's my DNA. I like to be transparent and honest and show people the right way to do things so that they end up with good results.
So what news do you want to share with everyone?
So the big news of the day is that Ross, Dr. Ross Kopelman, is now going to be a part of this channel. He is a hair transplant expert and hair specialist, and he's going to share with the audience, our community, how to regrow hair, retain your hair, and possibly transplant hair follicles to replace hair. And I may be one of those candidates right here up front. I may need some, but it depends on how much donor area we have in the back to replenish the front. So stay tuned. I think he's going to give you a lot of insights into the biology of hair, and also how to retain hair, regrow hair, and transplant hair. So stay tuned, and I think you're all going to enjoy this addition to the channel.
So I'm excited. I'm excited to, number one, be able to clinically practice with you and see patients and be involved in the practice, and so that's exciting. And then the second part is I am excited about being on this channel with you and continuing to spread information, medical information, and keep people up to date. I think it's going to be a lot of fun. Hair loss impacts millions of people, and so I think this is a great opportunity to kind of work together to educate. And
we're expanding the practice. We're expanding the practice into hair restoration, which is a very exciting area, and an area that I had previously somewhat ignored, but I realized that it's a very important part of the aesthetic concern of millions of people. So I'm really excited that Ross is joining us in this practice and in this effort.
So yeah, so we're going to be creating content together. We're going to be making individual content. We'll be putting out a lot more shorts going into 2024, and we're really just excited to grow this community. So please share this with friends and family. You'll get to know both of us and how we interact. We'll do more lives together. But yeah, we wish you a happy and healthy to you and your family. And we're going to help you right along in your journey to get the highest quality cosmetic results, regardless of where you go, whether it's on the West Coast, the East Coast, if you're in a different country. We really want to disseminate information and keep you up to date. So
okay, well, good luck and happy and healthy.
Happy New Year.
Happy New Year. How's it?